Hi everyone, my name is GOUDET. Let's get started. The clear cell hepatocellular carcinoma has so far been considered a rare and highly differentiated variant of hepatocellular carcinoma with a relatively good prognosis. The objective is to present a case of a patient with clear cell hepatocellular carcinoma and a good response to sorafenib. So let's get started with the case report. There was a 71-year-old woman with a body mass index of 24, no diabetic, denies hypertension, and she referred only a history of asthma management with bronchodilators, denies a history of smoking, and denies alcohol consumption. The patient began her condition in October 2016 with a sensation of gastric fullness, at times unintentionally losing of 30 kilograms in 5 months, accompanied by an increase in abdominal volume. So the patient saw medical evaluation and abdominal ultrasound was requested, in which an abdominal tumor, like we can see here in the picture D, of approximately 10 centimeters was observed in the left liver lobe. She was referred to the oncology consultation, and it was requested for an alpha-fetoprotein that was reported a value of 40 nanograms over milliliter. After 3 months of surveillance, the alpha-fetoprotein level increased to 92 nanograms milliliter and was negative for hepatitis B, superficial antigen, and negative for hepatitis C virus. Then an abdominal tomography was requested, in which 98 per 88 per 90 millimeters was evidenced in the tomography. So we can see here in this image, in this picture, the tumor. Okay, then the patient was taken to aspirate biopsy, reporting negative for malignant cells in the first biopsy, performing a second aspiration biopsy 6 months apart from the first, this time being positive for clear cell hepatocarcinoma. So we can see in the picture A, for photomicrograph with H&E, hematoxylin and eosine techniques showing an epithelial neoplasm based on hepatocytes with abundant cytoplasm and nuclei with little atypia. And in picture B, we can see for strong drive photomicrograph with H&E technique, the same neoplasia it's observed. The cells have small nucleus, some in negative with an organoid growth pattern in acini, vascular spaces, and intracytoplasmic bile pigment with HEPAR immunohistochemistry was positive, CD10 negative, and treatment with sorafenib was started. Later, she was sent to interventional radiology to assess chemoembolization. However, at the time of this 4-phase tomography, the patient had an allergy to contrast medium. Although it was possible to demonstrate that there were areas of necrosis, so it was determined to continue with sorafenib-based management, considered a good response of this based on these areas of necrosis. So, at the time of diagnosis, the patient had a non-cirrhotic liver, and other studies demonstrate the absence of portal hypertension. So far, it has continued with minimal gradual deterioration of the liver. So, actually, there was no signs of cirrhosis. Okay, and well, the survival of hepatocellular carcinoma is estimated at 5 years, that approximately 12%. However, there are studies that show that clear cell hepatocellular carcinoma has a survival up to 50%. It is considered that the clear cell hepatocellular carcinoma occurs between from 0.4 to 37% of all hepatocellular carcinomas, and in general has a good prognosis when it's diagnosed early. However, the prognosis will depend on the percentage of clear cells in the tumor size, if it is encapsulated or not, and a high level of alpha fetoprotein is a worse prognosis. Characteristically, clear cell hepatocarcinoma is composed of mixtures of clear and acidophilic ground glass hepatocytes with excess glycogen and or fat, and shares histology, clinical features, and etiology with common hepatocarcinoma. It's a relative rare entity depending on the literature that is revisited, but the importance of this case is to demonstrate a good prognosis of a clear cell hepatocellular carcinoma 4 years after the diagnosis of this patient, and the slow progression that she had, and the response to the management with a multityrosine kinase inhibitor that is sorafenib. So thank you for your attention, and that's all.